Hello everyone, my name is Dr. Ankita Singh, Leader, Department of Oral Pathology and Microbiology BBDCODS. Today's lecture is on permanent mandibular canine. The chronology. First evidence of calcification 4 to 5 years, enamel completion 6 to 7 years, eruption 9 to 10 years, and root completion 12 to 14 years. Now the dimensions. Cervicoincisal length of crown is 11 mm, length of root is 16 mm, mesiodistal diameter of crown is 7 mm, at the cervix it is 5.5 mm, labiolingual diameter of crown is 7.5 mm, at the cervix it is 7 mm, curvature of cervical line mesially is 2.5 mm, and curvature of cervical line distally it is 1 mm. Tooth notations in universal. Right side mandibular canine is designated as 27, left side 22. FDI, right side 43, left 33. Palmar, both right and left, it is written as 3, but with a symbol which is given in the slide. Contact areas, mesial is incisal third, distal it is middle third. Now there are 4 canine which are placed at the corners of the mouth. Maxillary and mandibular canine bear a close resemblance to each other and their function are closely related. It has self-cleansing quality, more stable teeth anchorage in the alveolar process of the jaw, and it maintains natural facial expression. Mandibular canine narrow mesiodistally than that of the maxillary canine. Root may be as long as maxillary canine but usually somewhat shorter. Lingual surface of crown is smooth. Cingulum is less developed. There is less bulk of marginal ridges. The cusp is not as well developed as that of the maxillary canine. Cusp ridges are thinner labiolingually. Cusp tip is on line with center of root from mesial and distal aspect. So this is the slide which shows all the aspects, the labial aspect, lingual, mesial, distal, and incisal aspect. This is the graph which shows all the aspects. So it is easier if you learn it from the graph. The labial aspect. From the labial aspect, crown is trapezoidal in shape. Mesiodistal dimension is less than that of maxillary canine. The crown appears longer than maxillary canine. Mesial outline of crown nearly straight with mesial outline of root. Mesial contact area near mesioincisal angle. Cusp angle is on line with center of root. Mesial cusp ridge is shorter. So this is the picture which shows your labial aspect. You can see that mesiodistal dimension is less and your crown appears longer than that of the maxillary canine. Your mesial outline, it is nearly straight with mesial outline of the root, and your mesial contact area is near mesioincisal angle, and you can see your cusp tip, it is on line with center of the root, and your mesial cusp ridge is shorter. You can see over here. Now distal contact area more towards incisal aspect but not up to level of mesial contact area. Labial ridge is present but it is not as prominent as maxillary canine. And cervical line labially has semicircular curvature apically. Crown slightly bent distally. So in this picture also you can see distal contact area toward the incisal but not up to level of mesial contact area, and your labial ridge is not as prominent. Cervical line, you can see the semicircular curvature. Root curvatures are infrequent, and when it is present, it is often in mesial direction. And your root tip is pointed apically. You can see your root tip more sharply pointed. So this is your lingual aspect. From your lingual aspect, you can see your lingual fossa. These are the lingual fossa. Crown narrow lingually than labially from the lingual aspect. Lingual surface of crown is smooth and regular. Cingulum is smooth and poorly developed. Marginal ridges are less distinct. Root relatively narrower. So in this picture also you can see the lingual fossas. You can see marginal ridges, they are less distinct. And then cingulum is present over here. And lingually, your crown is narrow. Also, your root is also relatively narrow from the lingual aspect. So in this slide, you can see your distal lingual fossa, mesolingual fossa, lingual ridge, distal marginal ridge, mesial marginal ridge, distal cusp ridge, mesial cusp ridge. And this is your cingulum, and this is your cervical line. So this is another picture from the lingual aspect. This is a picture of permanent mandibular right canine. And you can see the cusp tip, marginal ridges, lingual ridge, lingual fossa. There are two lingual fossa, as I've told you, and then cingulum. Now the mesial aspect. From the mesial aspect, less curvature labially on the crown with very little curvature directly above the cervical line. Lingual outline is like maxillary canine but differs in degree. Cingulum is not as pronounced. Incisal portion of crown is thinner labiolingually, which allow cusp to appear more pointed. Cusp ridges appear more slender. So this is your picture from the mesial aspect, and you can see your cingulum, it is not as pronounced. Also, your cusp tip, it is pointed, and cusp ridges are slender. Tip of cusp nearly centered over root with lingual placement in some cases. Cervical line curves towards the incisal portion, and labial outline, there is less curvature. Then little crest of curvature directly above the cervical line. Root, more pointed root tip can be seen. And there are developmental depressions mesially on the root, which are more pronounced and sometimes quite deep. So you can see tip of the cusp, it is centered over the root. Although in some cases, this tip may be is present with lingual placement. And this is your cervical line, which curves towards the incisal portion. Your labial outline has less curvature. You have more pointed root tip, and this is your developmental depression, which is more pronounced on the mesial aspect of the root. The distal aspect. From the distal aspect, shape of crown distally similar to crown mesially, except cervical line curvature is less towards the cusp tip. There are developmental root depression which are present, but they are not as pronounced as it is present in the mesial aspect. So this is your developmental depression. The incisal aspect. From the incisal aspect, the mesiodistal dimension of mandibular canine is less than that of labiolingual dimension. So this is your mesiodistal dimension and this is your labiolingual dimension. So mesiodistal dimension is less than that of the labiolingual dimension. And cusp tip and mesial cusp ridge more likely to be inclined in lingual direction. Mesial portion of crown more developed than distal portion from the incisal aspect. So this is your mesial portion and this is your distal portion of crown. In the root tip is more pointed than maxillary canine. And in developmental depression, I've already told you, mesially they are more pronounced. So that's all for your lecture. Thank you.